Well, it's time once again for a sponsored segment on First at Fort we call Medical Monday. On most Mondays, I talk to one of our sponsors from the medical community about the services that they provide. My guest today on Medical Monday is Dr. Terry Carlson from University Oral and Facial Surgery. Dr. Carlson, thanks for being with us today.
It's good to be here.
Yes, sir, absolutely. It's a good show to be on. We're going to talk about something that is called All-on-4. Now, I have no idea what that is.
The All-in-4 is a catchphrase name for a relatively new technique in which 8 to 12 teeth can be replaced using 4 implants.
Oh.
That's where the term 4 comes from. And it's a relatively new technique, but it has somewhat revolutionized the way we can restore and replace missing teeth.
There you are. And implants are the latest thing compared to like crowns and such, right?
That's correct.
Okay. Well, what's new and different about this compared to the way you guys have been working in the past?
Well, it used to be considered important to place a large number of implants to replace all of somebody's upper or lower teeth, but with this new technology and using this technique, you can use only 4 implants to essentially replace all of your upper teeth or all of your lower teeth.
Wow.
So it simplifies what used to be a more complex problem.
So if you had, let's go with the maximum number, let's say 12. If you got 12 teeth, they got to come out. I'm not sure what the reasons would be. I'm not a dentist, but they're in bad shape. They need to come out. Person's in pain. Instead of having to do 12 individually, you can get by with doing 4? Are
That's
these
correct.
Big plates, or how does that work?
They are standard dental implants that are somewhat shaped like the root of a tooth, and anywhere from 10 to 15, 16 millimeters long, and they're made out of titanium. And a lot of the original research for implants, of course, goes back to orthopedic surgery, but what we've discovered, the people that developed this technique, is that by using 4 implants, you get more than enough support for up to 12 teeth. This greatly simplifies restoring somebody's teeth and eliminating their need to wear a denture or a partial that you have to take in and out.
There you go. So it's less aggravation in the long run, too.
Right.
You don't have to worry about you're out eating something and maybe you order a steak and, the effort grip or whatever it is just doesn't quite work, and next thing you know, your teeth are on your plate or in your water glass or something like that.
It makes chewing much better, and although we can't completely duplicate what God gave us to begin with, it's by far the next best thing.
Now, is this something that anyone can have done, or can you get too old for it, or how does that work?
We've probably done this procedure on people from their mid-20s up to their 80s. So the key is that you have to have enough bone to put the implants in, and we have basically a miniature CAT scan machine in our office, which is also fairly new, and that allows us to find places to put the implants that we weren't able to do previously with the standard x-rays.
There you go. So it's I don't want to call it customized, but it's more about the individual person's mouth than I guess it used to be, right?
That's right. And on computer, we can actually do the surgery virtually on the computer before we do it on the patient. This simplifies the technique when we go to do it on the person. And it's kind of like you do a trial run and then you do it on the patient.
Okay.
Makes it go a lot faster, much more predictable, and the success rate's been really high, upwards of 90+%.
All right, well, Dr. Carlson, we're out of time, but thank you so much for being with us today.
Thank you.
If our sponsor sparked your interest today, then you can give them a call down at University Oral and Facial Surgery. The number is 205-556-2323. You can find out more about them online at uofsdocs.com.